Thank you, Kaho, for giving me this opportunity to chair this very, very important session on scaling technology building on COVID. So we all know that we have, I think we were in technology from before COVID. We will not say we were not there in technology before COVID, and CAHOTECH has been conducting these technological updates even before COVID. But yes, now is the time to build up and scale up on what we have learned, what experience we have gained, and have we scaled up? Have we grown? Have we progressed? Have been able to adopt the technology based upon the needs of the clientele, the needs of the recipients? What better way to have people with us who have gone through it, who have been in this, and who have got their own case studies and own success stories to share with us. So I think I'm very grateful to CAHOTECH for giving me such an elite panel who have the experience, who are going to share with us today some of their own individual case studies and will tell us how the technology can be scaled post-COVID to take it to the next higher level. I have with us Raghavendra Prasad has been in the thick of things during COVID. He is the founder of Project Step 1, which is a non-profit setup which has helped India fight COVID and still helping India to fight COVID by providing free telemedicine access to COVID-affected citizens across 21 states in this country. I salute you for taking such a big step forward. A very good approach from your side, and very good, I will take it, a nationalistic effort, which is totally free of cost. And he has been, of course, an active investor to various and advisor to many technology startups. His primary interest is technology, and that we can make out. And his another interest is to integrate technology with economy, with healthcare. Now, these three things, if they get integrated, I think we can, look at universal health coverage in not too distant a future. He also founded Quickwell in 2011. He's a pioneer in digital healthcare in India, which was acquired by Practo in 2015. Over 20 years, he has 20 years of experience in software industry. He's a computer science graduate from Ramaiah Institute of, I always said medical science, but Ramaiah Institute of Technology, I can say that. And he started his career as a programmer. He worked on many missions, many critical global products. He has got a knack and he has got a flair for solving people's problems using technology. And most of his career so far he spent just doing that. He's got a very keen eye for spotting trends in technology. He has launched over a dozen global products and has over a dozen international patents to his name. While, of course, because he's working so hard, he acquires knowledge during his travels. He's a very passionate traveler as well. He's a biker also, very passionate biker and an athlete. He has won several awards for his work. I will name some of them. One was Karnataka Rajyotsava Award in 2021 for social service during COVID. He got a Republic Day Award 2020 from Government of Puducherry for the COVID support, and Amazon Best Service Award for City on Cloud, for the City on Cloud Award for High Impact Technology Innovation during COVID. Advocate Award by CIA, IWN, CIA Karnataka and Young Indians. UNICEF and Rise Foundation Award. I think I will not read more of your awards. Mr. Raghavendra, please forgive me, because there is a whole plethora of awards, but that shows how much you contributed through technology toward the healthcare delivery. Now I want you to share that experience with all the audience. Over to you, Mr. Raghavendra, please.
Thank you, Dr. Kapoor, for the introduction, and really honored and privileged to be amongst this elite group. Thanks to Som, Dr. Alex, and everyone for having me here. It's been, I would say, a bigger privilege to be part of Project Step 1, because all of us would look for an opportunity to be able to serve and make a big impact, and that happened with Project Step 1. So I'm equally grateful and privileged that I was in the middle of that. What I thought I will do is not take slides, given we are running against time. I will quickly tell what Project Step One did and what were the lessons we learned along the way, which could be useful for all of us as people concerned about providing universal healthcare coverage, and how can we adopt that, and also a little bit about what Step One is doing towards that. So, Project Step One was actually born with a very modest goal that we will help people in Bangalore if they need to get to a doctor. We will provide a way by which they can easily connect. Just call a number and get it. They'll get speaking to a doctor. That was our modest ambition when we got together. But what transpired was this facility was required across the country. So what started when we went and approached the state war room, they said, why just Bangalore? Why not the entire state? And as soon as we said, we said, okay, let's try that. And when we, on the very first day, we were inundated with 10,000 people calling us. So we figured out that we had to build a lot bigger infrastructure than what we had planned. So we actually put out a note asking doctors to volunteer their time to take calls from citizens. And we sent out this note on WhatsApp by afternoon, and by evening we had about 800 doctors sign up. So that gave us a lot of confidence, and also it shaped what Step One eventually became, which was a technology network completely run by volunteers. It was built by volunteers, technologists volunteering their time to build a very sophisticated telemedicine system, which we actually ended up rolling out. Doctors who are volunteering their time to consult on this platform, as well as several other talented people, approaching governments, customizing these solutions, working with corporates to get more volunteers onto the platform. So a whole lot of things, which eventually ended up, us working in 21 states in the country, touching 35 million people, and enabling over 10 million free teleconsultations. And this was, we say we were able to touch from Kanyakumari to Kashmir and from Mumbai to Manipur. So we covered the length and breadth of our country with this network. And this whole thing was delivered free of cost to the governments also, because it was mostly volunteer driven, and we had some. The only cost we had to for the system was to keep the system running, and we had some very generous contributions from organizations to keep the cloud and the telephony systems and the whole network running. So, if I were to tell you in a different way, what we were doing was, what Step One is it's a Uber-like system. Uber in one way connects drivers with people who are looking for transport. We were connecting people who are looking for healthcare with people who can provide healthcare, right? I don't say specifically doctors, because we had several different types of innovations around that. I'll speak about that. This Uber-like system, on one hand, was getting the demand for this was coming from helplines, which were set up by the government and publicized by the government. So they naturally attracted a lot of citizens' attention, and they were all calling on these helplines. That was one mode. Another way was, when the people who are turning positive, we used to get the data of that at real time from the governments. And our job there was to call out these people to check their symptoms and see if, they need to be provided a bed, or if they can be recovering at home. In addition, we were also monitoring these people while they were recovering at home. We had an entire home isolation monitoring solution. And that was the demand side. On the supply side, we had, of course, doctors would actually provide consultation to these patients. But what we figured was a large majority or several people who were positive or who were calling did not actually need to speak to a doctor, because they were calling so they were calling because of various other reasons, right? Various other medical reasons. And some of these questions could be answered by trained professionals. So we had an entire team of initially it started with corporate employees who are volunteering their time to do triaging. So this triaging system would determine whether the patient really needed to speak to a doctor. So if, as I mentioned earlier, we had about 35 million people whom we got in touch with, but we had only about 10 million people who had to speak to a doctor or a qualified medical professional. So we were able to address the rest of the 25 million without them having to speak to a doctor. That's, I would say, one of the innovations that we did. It's not new, but I feel it's something that is leading us to believe that a lot of aided by technology, we could get non-doctors to perform some of the functions which are performed by a doctor, which could alleviate and relieve the doctor's time, so that we can address a larger number of people. The doctors can potentially address a larger number of people, and we can get a larger number of people covered by us. So that is one takeaway I would like to bring in here. Another thing which I would also like to bring in is that I think when we talk about public health, right, it's very, very important to work with the government, right? We are at the end of the day, the public health, the leader of any public health system is the government. And we have a lot of learnings working with the government, because we were not just, we figured out a model by which we were working literally as an extension of the government. So we were essentially part of the same team. And that, I think, is a model which helped us scale, which gave the, we were not bidding for tenders. We were not, we were not ever looked at as a vendor. So that, I think, is somehow a model which all of us need to evolve into. So there was integration of people, but there was also integration of systems, right? One of the key things that we found was, if we were just giving technology to the government, it would never work. So we had to run this piece of technology ourselves, but in a seamless manner with the government. So we were able to accomplish this at scale. And I believe this is also giving us a model on how we should approach public health, work very much with the government, because that is a sector where, they are the leaders, and they actually get the demand, which is, I would call, as a long tail demand. And being able to serve them is very, very hard. But and that's actually a place where technology can really help in scaling that demand. So with this, I would, I would like to say that we are actually using the same technology that we built for many non-COVID interventions. We are in the process of converting many of those COVID helplines into generic telemedicine helplines, and we are well on our way. So we are, using the assets that we created, the public assets that we created for telemedicine going forward. Plus, we are also using the same technology. I think Dr. Sangeeta was alluding to using monitoring of NCDs, and that's something we've already started in a few states, and that's something we are looking to scale. We believe that we are at a unique time in our history, where our history of humanity, where we can use technology to reach every individual personally. And I would say we are well on our way to actually realize that in at least some small use cases like NCD, like mother and child, in at least a couple of states, which is going to help us scale this into many more areas. With this, I would like to stop and hand over the floor to Dr. Kapoor.
Yeah, thank you, Mr. Raghavendra. Thank you very much for sharing your experiences. I thank all of you for your elaborate presentation of covering the subject so lucidly and sharing your experiences. All I would like CAHO to do is to take over from here, because now we are just talking of scaling up technology, but these dots have to be connected. And these dots have to be connected to give a holistic, angle to the entire technology usage in the healthcare delivery system, to reach out to the unreachables. I know we have problems, but we have solutions. I also know that it is easy to cry and make things difficult for us, but I believe that to make things easier, it is better to try than to cry. So thank you very much, all of you. Thank you, CAHO, for giving all of us this opportunity to share our views